probably heard of developmental milestones and red flags to look out for at different ages that may indicate that your baby's development is not on track. But what you may not realize is there is actually a separate set of red flags that are much more serious. These are things that you should never see with your child at any age, and if you do, it may be an indicator of something quite serious that needs intervention from clinical specialists. As with most of these things, early intervention is really important. Generally, the earlier you can identify a problem and seek the help your child needs, the better the outcome for your child, and often it also means the intensity and duration of treatment required is less. So let's go through these developmental red flags that you should never see at any age. This first one can be a bit tricky to spot as it might seem like normal behavior at first. It's common for babies to temporarily stop using a skill when they learn something new. For instance, your baby who was babbling non-stop just last week might become quieter while they're learning to crawl. They'll still interact with you, perhaps by smiling or giggling, but their babbling might take a back seat for a bit. In these cases, your baby hasn't really lost the skill, they're just choosing not to use it while they focus on mastering their next developmental milestone. Then, once they've mastered that new skill, they go right back to doing whatever they were doing before. However, if your baby seems to lose skills and doesn't go back to it, or if they start struggling with things that they used to do easily, that's a cause for concern. For example, if your baby rolled over at 5 months and then sat at 7 months, but then started having difficulty with these skills later on, that's a developmental red flag. This loss of skill is known as a developmental regression, and while it's rare, losing skills like this can sometimes indicate a more serious issue. So if you ever notice that your baby is losing skills and they're not coming back to it, it's important to consult with your pediatrician to ensure that your baby isn't experiencing a developmental regression. And as always, don't rely on YouTube videos for diagnosis. These sorts of things always require a visit to your doctor or pediatrician. This next red flag is extremely easy to overlook, especially in the first 6 months, and that is your baby's response or lack thereof to sounds, which could indicate potential hearing issues. Recognizing this early is vital because undetected hearing issues can hinder your baby's overall development, in particular their ability to communicate. So it's important to stay alert and actively watch how your baby responds to sounds, keeping in mind what the usual responses should be based on their age. So here's what you would typically observe if your baby's hearing development is progressing as expected. From the moment your baby is born until they're 4 months of age, they will show you that they can hear in 2 main ways. Firstly, they will startle. This is when your baby jumps because of a sudden loud sound. When this happens, they usually stretch out their arms and legs and then they'll bring them back into their body and they may even cry out. The second way your baby shows you they can hear is by reacting to the sound. They might become very quiet as if they're trying to listen, or they might try to find where the sound is coming from. In their first month, they'll only move their eyes to look for the sound, but after that first month, you'll see them start to turn both their head and their eyes to find where the sound is coming from. From 4 to 8 months of age, your baby will use more obvious signs to show you that they can hear. They will smile when you talk to them and babble back in response, as if they're trying to have a mini conversation with you. They will also start to recognize simple words such as their name. From 8 to 12 months of age, your baby will show you they can hear in several ways. They'll respond when you call their name. They'll mimic sounds that they hear. For example, if you say ba ba ba, your baby might try to repeat that back to you. And they may even start saying simple words like mama or dada. So if your baby doesn't show you these signs in response to sounds, it's a good idea to get their hearing checked just to make sure that they're hearing okay. This next red flag, which again is often overlooked, could indicate a problem with your baby's vision. This often goes unnoticed because it's commonly known that newborns don't have perfect vision at birth. However, what's lesser known is how rapidly their vision develops in the first few months. As a result, you might mistake a vision problem for normal development. But it's really important to pick up on vision problems early, as vision is crucial for almost all aspects of development, including fine motor skills, gross motor skills, social skills, and communication. This means unidentified visual issues will have a flow-on effect impacting many areas of development. To identify if your baby does have a vision problem, you first need to understand what normal vision development looks like at different ages. At birth, your baby is nearsighted and see things best when they're pretty close, which is about 8 to 12 inches away or 20 to 30 centimeters away. They can make out big shapes, faces, and bright colors. And in that first month, your baby will start to focus on things that don't move, like a toy or your face. And then in the coming months, they'll get better at using their eyes together so that by 3 months of age, they'll be able to focus on a toy and follow it if you move it to the left or to the right or up and down. You'll also notice that in those first 2 to 3 months, your baby's eyes may occasionally point in different directions. I talk to a surprising amount of parents who do see this and are really worried about it, but at this age, it's totally normal. But after 4 months of age, your baby's eye movements are more coordinated and should point in the same direction at all times. And your 4-month-old should also be able to see clearly across the room. So if your baby is older than 3 months of age and they cannot follow your moving face or a moving object with their eyes, or they're older than 4 months of age and their eyes move quickly from side to side, jerk or wander randomly, or they seem to be struggling to see things so they're not reacting to bright lights or your face, it's important to get their vision checked. This next red flag to look out for is related to your baby's physical development. Ideally, both sides of their body, their left and their right, should feel equally strong and move the same way. If one side seems weaker, doesn't move as much, or feels different when you touch it, like one arm is softer or harder than the other, this could be a sign that something's not quite right. For example, you might notice that your baby favors one side when they're reaching for toys, rolling over, or even while they crawl. Or there might be a noticeable difference in the muscle tone on one side of their body, so in their arms and their legs. So one side might appear more relaxed or less developed than the other. These differences can sometimes be normal, but they can also be an early sign of various developmental issues which require medical intervention. So in any case, if you observe persistent asymmetry or significant differences in strength, movement, or muscle tone between the right and left sides of your baby's body, it's a good idea to talk to their doctor for advice and possible further evaluation. The next red flag relates to developmental milestones. These are key behaviors and physical skills that babies typically learn as they grow, like smiling for the first time, rolling over, sitting up, crawling, walking, and talking. And while every baby develops at their own pace, there are common timeframes for reaching these milestones. For example, most babies start rolling over from around 4 to 7 months, they sit without support between 6 to 9 months, and they usually begin walking between 10 to 18 months. These timeframes are based on years of research and provide a guideline for typical child development. If you want to know what milestones your baby will achieve in their first year of life, then make sure you get my free developmental milestone chart by clicking the link below this video. Given that these milestones do provide a guideline for typical child development, if a baby or child isn't reaching these milestones within the expected time frame, it's considered a developmental red flag. This may indicate that they're not developing at the same rate as their peers, which could signal a developmental delay or a more serious concern. So if your baby isn't hitting their milestones within these expected timeframes, it's important to speak with their pediatrician or doctor. They can evaluate your baby's development and, if needed, recommend any specialist or early intervention services. Now, to ensure that your baby's development is on track, you don't need to memorize and keep track of every single milestone they achieve in their first year of life. There are simply way too many and it's just overwhelming. But there are certain milestones that we do expect babies to hit at the very latest by 3, 6, 9, and 12 months of age. And as a parent, it's important you know what these milestones are and how to spot them. So to help you with this, I've made 2 extra videos that cover the developmental red flags at 6 months of age and at 12 months of age. So just pick the video that suits you best and head on over and watch that next.